For my topic, I chose to do drug use and addiction. More specifically, I decided to focus upon psychoactive drugs and behaviors that these drugs encompass. Some popular types of psychoactive drugs include nicotine, opioids, alcohol, LSD, caffeine, narcotics, depressants, stimulants, and many more. The definition of a psychoactive drug is a chemical substance that alters the central nervous system and alters brain functions temporarily. There are many different types of these drugs, but the more popularly known ones are the ones seen on the screen. Psychoactive drugs were originally used for spiritual ceremonies. Priests would use them during ceremonies for medicinal purposes. This has later led to the use of psychoactive drugs in a popular medical setting. Psychoactive drugs are used to combat pain of patients, ease their nerves, and to even sedate people for surgery. Not all psychoactive drugs are used for the same purposes today. Most are used for recreational use today. Many medicine cabinets over time have accumulated many of these psychoactive drugs due to being prescribed by doctors. This can often lead to overuse and addiction. Psychoactive drugs like alcohol and marijuana, and more popularly caffeine, have become a regular part of almost 55% of the American population. There are different classifications of these psychoactive drugs. These classifications include stimulants, hallucinogens, deliriants, depressants, steroids, and behavioral drugs. These drugs have different effects on the physical and mental parts of the body. First, stimulants affect the body physically by creating heightened senses, heightened alertness, and depletion of body chemicals. Mentally, stimulants cause excitement and a rush of adrenaline. Next, hallucinogens. Hallucinogens physically cause nausea and dizziness. Many of these hallucinogens are consumed by the plant version of these drugs, which we will later go into detail about. Hallucinogens alter the mind mentally by causing visions and extreme physical feelings that aren't actually there. Deliriants, most often there is a central nervous system depression, which causes dizziness, slurred speech, unsteady gait, and drowsiness. Deliriants mentally create confusion and sometimes a rush of adrenaline, but which is rare. Depressants physically slow the heart rate and respiratory functions. Depressants can help induce sleep, dull senses, and can, most importantly, diminish pain. Mentally, diminishing pain physically creates a feeling of calmness or at ease. As for steroids, anabolic steroids can increase muscle mass and strength. This physically makes you look stronger, but can also have other effects such as giving you acne or growing other hair. Mentally, increasing muscle mass can create confidence, masculinity, but can also cause aggression mentally by these feelings of overconfidence. Behavioral drugs physically change the central nervous system due to chemical imbalances. It can also lead to the development of psychological disorders, infatuation, increased needs, and emotional attachments. As stated before, many psychoactive drugs have become used for recreational activity only. The most popularly used by teens and young adults in America are the following drugs: cannabis, alcohol, nicotine, and caffeine. Cannabis is commonly known as marijuana. Marijuana is used recreationally when smoked and consumed. Marijuana is a stimulant as well as nicotine and caffeine. Stimulants act on the central nervous system by increasing muscle activity and energy production. On the other hand, alcohol has an opposite effect. Alcohol is a depressant. It slows all functions of the central nervous system. All these drugs are used for feelings to avoid pain or used to get high. These feelings come when partaking in them, whether you're consuming them or smoking them. Most recreational use leads to addiction today in America. Some myths regarding psychoactive drugs. Substances that are grown naturally are thought to be less harmless. Many of psychoactive drugs come from mushrooms, cannabis, and marijuana. Mescaline is found inside cactus, and it is a hallucinogen, so it causes effects of visions and other things. Marijuana is a natural grown substance from cannabis and can be used for health purposes, used to create clothing or anything, but consumed wrongly and smoked, it creates a high and is a stimulant. Psilocybin is found in raw mushrooms and grows in grasses and is also a hallucinogen, just like mescaline that is found inside of cactuses. Some statistics about addiction in America. 21 million Americans have at least one addiction. Americans abusing drugs between the age of 18 and 25 are more likely to develop an addiction. Alcohol, opioids, cocaine, and marijuana are the most abused drugs among teens in America. 43% of American adults admitted to have tried marijuana at least once in their lifetime. The importance of this wellness course pertaining to psychoactive drugs is meaning that it educates us on how these drugs can affect us emotionally, mentally, and how this can affect spirituality. Having knowledge is power. Knowing what things are harmful and dangerous to the body physically and mentally prepares us in becoming healthier. Becoming healthier refers to all aspects, not just our physical body. To achieve wellness, we must take care of our entire body. Becoming educated about the negative effects of psychoactive drugs can help aid in keeping people drug-free. In sum, psychoactive drugs are any type of drug that alters the central nervous system. Primarily, they were introduced for medicinal uses and have become more regularly used for recreation over time. Psychoactive drugs have positive effects when used properly. Drug abuse and behavior that accompanies it happens when psychoactive drugs are overused.